Hello, I'm Dr. Shea. I've been a chiropractor for over 30 years, and I'm here to demonstrate some exercises that I've used with my patients over those last 30 years. Hi, this is Dr. Shea again. A lot of my patients that have low back pain also have hip pain. So I'm going to go through some exercises that I use to help strengthen the hips to help stabilize the low back. One of the very important ones I do is laying on your back, so I'll demonstrate on my adjusting table. You lay on your back, keep one knee up, arms to your sides here. You bring the knee up so it's perpendicular with the floor, and then you do a small circle the size of a frisbee. This will oil the hip joint, which is stimulated by the movement of the hip. So even though we're spinning the knee, it's actually working on the hip joint. Keep the circle small, at least initially, depending on what kind of pain you might be having. Now I'm doing it clockwise and counterclockwise. 10 repetitions in each direction. Then you always want to do the other side also. So bring it up so it's perpendicular with the floor, and then go around that position, clockwise, 10 repetitions, and then counterclockwise repetitions. 10 repetitions, yes. And what happens, all our joints are self-lubricating, and many times with low back pain there's a hip problem with range of motion because it's not moving well, it's not oiled well, and it becomes very stiff. So the hip circles, the knee circles rather, that help the hips will a lot of times help all the low back problems that the patient is having. So I always include that in with a low back problem patient, is the knee circles. Also, because of that, the feet and the knees can be affected. So I will have the patient oil their knees by simply lifting their feet like so. This is non-weight bearing, so the knee joints can better tolerate this movement. And every time I lift my knees, I'm oiling the knee joints. So simple movement will cause the cells that release the lubricant for the joints to release their oil, so to speak, in the joint. Just like that. And then, toes, I have the patient scrunch the toes forward to help build the arches in the feet, because so many people also have flat feet as well as knee problems and hip problems. So why not do two things at one time? It saves time and it's more efficient. So you bring the knees up, the feet up, straighten the knees, scrunch the toes down, and then relax. I have the patients do 10 repetitions every morning, every night. Easy to do in the office too.